Hi, I'm Dr. Elizabeth Roy. Thanks very much for visiting the OSHOT website. I'm very excited to tell you that Dr. Runnels will be giving away OSHOT procedures to the attendees of the Oscars. And this was done last year with Vampire Facelift. Very, very successful. One reason and one reason only why we're doing this, and that's to raise awareness so that we can start talking about female sexual dysfunction and the viable treatment that is available. There is huge problem with female sexual dysfunction affecting 50% of the population. And women don't have anywhere to go. They go to their physician quite infrequently. The question is not asked of them by their primary care physician or GYN quite often. And if the conversation does come up, there aren't a lot of options. So physicians tend to avoid this kind of thing. Patients have a significant mistrust of physicians these days. Unfortunately, often they'll trust the clerk at the vitamin store or the natural food store before they talk to their physicians. Celebrities have been very successful in raising awareness and very generous with not only their wealth but their fame. Suzanne Summers did an amazing job helping men and women understand how they can be treated very effectively with bioidentical hormones and some nutritional strategies. Angelina Jolie has been incredibly brave in being active in having both breasts removed to prevent breast cancer, as well as introducing women to genetic testing that's available. Michael J. Fox living with Parkinson's disease and raising awareness. And you know, many of these celebrities are affected by the problem, which then often causes them to act and to speak out. 50% of women have female sexual dysfunction, and at least as many have urinary incontinence. And it's a big problem. So when we say female sexual dysfunction, we're talking about well-known problems that are written about in GYN journals and other medical journals. Decreased arousal is a problem, inability to orgasm, vaginal pain. You know, these are significant issues that affect women, that affect their confidence, their productivity, the way that they interact with the world, affect their relationships with others as well as themselves. And when you want to talk about urinary incontinence, at least as many women have this issue as well. Whether it be a stress incontinence due to having children and having some muscular changes, or an urge incontinence, which is incredibly difficult to treat, but completely resolved quite often with the OSHOT. You know, and it's risky for me to stand here and tell you this because there isn't a study that's been sponsored. And that's the shame. We have many medical device manufacturers and people who, companies rather, that create PRP kits and tools for us, yet they won't jump into the arena of sponsoring a study for female sexual dysfunction. They will for male sexual dysfunction. There are studies right now that are being run. So it's a real problem. And I can tell you that many of the people, the women that I've treated, we've resolved urinary incontinence that was severe. So we're calling on celebrities and hoping that one or a handful of these women will be positively affected by the OSHOT and will be willing to speak out and introduce the public as well as physicians to these wonderful procedures. When women have sexual dysfunction and urinary incontinence, they don't get any better unless they're actually treated. And this inequality in the treatments that are available is very disturbing because women suffer silently, and that's the problem. You know, if you have a broken leg or a broken arm, people sign your cast. If you are affected by some physical problem, then it's obvious and you're not questioned. But when there's things like depression or schizophrenia or sexual dysfunction and incontinence, it's not talked about. We may laugh about it, and that's what you're going to see in the media. You know, there's going to be a lot of headlines about this offer to the Oscar attendees. And I welcome that. I really do. Although it's not an issue that's humorous, we can certainly bring some humor to the arena so that we can start talking about these kinds of things. urinary incontinence is more than just bothersome. It interferes not only with intimacy, but it interferes with activities of enjoying things that you used to enjoy. And it gets worse. It happens to be the #1 reason why a woman is admitted to a nursing home. You don't think about this, but her family is able to care for her until she is incontinent. Then it becomes a medical complication, there's infection, there's cost, there's hygiene issues, and then they have to admit her to a nursing home. So there's value in these procedures, and there is an absolute need for these procedures. So hopefully we can get some celebrities to participate in spreading the word. Certainly we could pay a celebrity to endorse this procedure. That's not the point. We don't want to harangue people into speaking out about this. We want them to have the experience and the benefit of these procedures so that they can sincerely get behind them and carry it forward and make this more of a mainstream. We train physicians to do this if they are amenable. We have procedures for men as well. There's no discrimination here. The rich plasma is really wonderful at regenerating tissue, and so it makes sense to use it for this particular reason. I have a book that will be released this spring that has an abundance of patient testimonials as well as physician testimonials. You know, when you see the providers on this website, these are doctors who are providing this service to their patients. We're talking to each other. We're excited about what we're seeing for results, and we're hoping that the media will help us get this word out. So thank you very much. I appreciate that you have watched this. Please look for a provider in your area, ask us questions, and hopefully together we can get some studies going so that we can truly quantify the benefit and identify how to make this more available throughout the country, and throughout the world for that matter. 50% of women have this issue. Thank you very much.